Uh, Good afternoon, everyone, or for those in other time zones, good morning, perhaps. Thanks very much for the introduction and to CCSN for the opportunity to speak and join you today. We are in a bit of an interesting period in Ottawa, which is expecting a budget which will be coming in the next number of weeks. But we're also, in many senses, trying to predict the future. And so I've just added a nice quote from the famous physicist Niels Bohr. Prediction, of course, is very difficult, especially when it's about the future. And that's a bit of what we're dealing with today as a bit of a disclaimer. That said, I think we do have a bit of a sense of many of the issues which are on the federal radar, the current Trudeau government here in Ottawa, and particularly how some of those could potentially impact patients. So what I'm hoping to accomplish today is really a couple things. One, to provide you with a bit of a sense of what we're expecting to see. What are some issues to look for in the federal budget based on some of those discussions and some of the pieces that have fed into it in recent months. But secondly, I'd also like to take a few minutes towards the back end of the talk to talk a little bit about advocacy and engagement. Maybe put forward a few ideas and suggestions to get all of us thinking about is it useful and what would be most effective given my interests and priorities and those of my organization to engage on those policies and make sure that particularly that patient perspective is understood and heard by those who are decision makers. So why don't we jump into it? What should we expect in this upcoming budget? The first and the most basic question is timing. We were all under a very strong sense that they had originally wanted to do this at the end of February. We're now, of course, well into March as of day one, March 1st today. The best sense is that March 21st, which is a Tuesday, will be budget day. There was actually a committee meeting in the House of Commons last week, and one of the Liberal MPs blurted out that that was the date. Whether that was the official announcement or not, I suspect not. But I think increasingly the chatter sort of in Ottawa is that that will be budget day. So mark that down in your calendars, but you will expect to see an official confirmation reasonably soon. Looking at the big issues in healthcare and what will need to be addressed in the budget, we have to start with the sort of macro picture. I think all of us have watched the jockeying and the various discussions take place in recent months around the health accord. And as many of you know, Prime Minister Trudeau and the Liberal Party ran on a campaign to renegotiate the health accords. The last time that there was an official Fed-Prov negotiation was 2004 under Prime Minister Paul Martin. Under Prime Minister Harper, there was a somewhat different approach, which was to essentially allow that earlier agreement to lapse. And the federal government, under Mr. Harper and the Finance Minister Jim Flaherty, said basically we are going to set on our end unilaterally the financial terms of transfer. We're going to stay out of the way and let provinces and territories exercise their jurisdiction and deliver health care. The Liberal Party tends to take a little bit more of an active or interested view in healthcare, and so clearly the Liberal Party wanted to run and were elected on, in their view, a role of a little more federal leadership on healthcare. So that brings us to where we are today, which is a very interesting state of affairs. We have a number of bilateral health deals signed between various provinces and Ottawa, actually reinforcing the 3% Canada Health Transfer target. So this is the major source of federal funds for healthcare. You've all seen the media and the back and forth jockeying. Provinces clearly looking for additional funds beyond 3%. They had proposed, I think, at one point as a collective 5.2% for a number of years to provide them with the kind of funding predictability to allow them to deal with a changing healthcare system and, of course, changes in demand, population demographics, etc. Ottawa is saying, no, we're not going to commit to those much larger block transfers. We'd like to continue to hold you to account, provinces, on innovation, on delivering care in a more effective way. However, as a federal government, we have a specific interest, and I know this is of interest to many patient organizations, in home care and in mental health. And so what we're prepared to do, this is the federal government speaking, is to commit to the 3% annual increases, but to provide you with additional funds on top of that directed for those specific purposes. So that's what they've done in these agreements, and you'll see BC, which was the most recent one as of last Friday, I believe, Saskatchewan, Northwest Territories, Yukon, Nunavut, New Brunswick, Nova Scotia, Newfoundland, and PEI. We're actually hearing that Alberta is probably the next province to sign on, and that could happen at any time. But it leaves, frankly, the largest population centers outside of that. And you've seen in the media a lot of the frustration on the part of particularly the Quebec Health Minister, Dr. Barrette, is concerned about the United Provincial Front being chipped away at. I think it's a question for all of us to reflect on as we engage on policies of interest is that 3%, the big picture financing of healthcare, does that seem like an appropriate level, like a fair level? Do the provinces have a point to make, which is we're being asked to finance healthcare on a much growing demand. We're not getting the same contribution from Ottawa. Or are we sympathetic to the view which says, you know what, we'd like to actually see greater innovation in healthcare delivery, in system design on the part of the provinces, and we can't simply keep rewarding some of those old structures and ways of doing that were maybe not getting us the health outcomes that we wanted. So these are just some ideas and some thought starters as we go forward. As a final comment on the health transfers, I think just from a budgeting, bookkeeping issue, it will be interesting to see how the federal government presents this and what sort of commentary accompanies it, because they've essentially, as I say, signed a number of deals, but it's not deals with everyone. And so some are in, some are out. How do we account for that? I think will be very interesting to see. So moving along as we think more a little bit about the drug world, which is certainly a complex one. There are multiple points of contact for patient organizations, for clinicians, for industry partners. There's various regulatory stages, various types of reviews. And I think we're at a point now where Health Canada is using language, what I would call the AAA. And I put the logo on here. If you have your car breakdown, you can call AAA. Well, I think increasingly when we're talking about pharma policy, it's a AAA discussion. And those are first affordability. And by that, we see Health Canada talking more and more about the Pan-Canadian Pharmaceutical Alliance, but also the Patent Medicines Prices Review Board, or PMPRB, as ways to drive affordability. That is becoming really a buzzword, but of course the details really matter, and understanding what that is will be important. And I'll come back to that in a minute. The second A is accessibility. Again, dealing with the cost of medications, they feel is part of that, but also around how products are being made available following their review. And so there's this discussion, and it's very, I would say, general, but this notion of prioritizing certain products. So if a product is wanted specifically by a healthcare provider, if it is wanted by a drug plan in one of the jurisdictions, how can we better coordinate and understand the pathway for that product and perhaps accelerate it? I'll come back to that as well. Finally, the third A is appropriate use. And this is a topic, I think, which a lot of conversation has taken place. It will continue to take place. Going back to the 2004 Health Accord, many of you may remember as part of that, there was the National Pharmaceutical Strategy, which included a number of policies meant to help support appropriate use, including within that was the creation of the Common Drug Review and additional use of health technology assessments. In the current context, we see a lot of attention being paid to issues such as labeling. So there's been a lot of work on plain language labeling to try to make that safer and more accessible for the general public. Also some specific new requirements for opioids, which is becoming very much a public health concern, as everyone's aware. And finally, and I just flag it, and I've included the CADIF logo, this notion of moving away, not necessarily away, but beyond health technology assessments to health technology management. And so that's the HTM you see at the bottom of the slide. health technology management is much more of a dynamic and integrated approach. So we're looking at much more reassessments of products and procedures in our healthcare system, making decisions at multiple points across the continuum, less focus on just purely the entry of new products and technologies and treatments, and more about how they're being used over time, taking into account real-world evidence, etc. This leads to more interesting policy decisions around things such as disinvestments, which can be controversial and must be approached with some care. So just to reinforce, I think, some of the points I've just made, that when we talk to Health Canada, they're very much taking a quote-unquote system approach. They recognize that Canada's system, because of the way it's evolved, our constitutional structure, is a little bit unique. There isn't a good country out there that Health Canada can look to very quickly and say, yes, of course, that's an easy, natural lesson that Canada can draw from. They do, of course, watch many jurisdictions and try to understand those policies, but there's a recognition that we're going to have to do things that are very tailored and unique to Canada. So some of the other themes to look for in the budget, again, I talked a little bit about the reimbursement process. Time to listing is a topic which I know is of great interest to patients looking for an understanding of when innovations will be made available, how predictable that process will be, under what terms, etc. I mentioned the prioritization issue. I think, frankly, there's a concern around deprioritization, that if you are starting to pick and choose certain products, what are the reasons for that? What are the rationale for that? And if there's things that are not viewed in the same lens, what will be the state of those and the fate of those? Are there appropriate transparencies built into those process? What are the expectations that patients should have? What are the expectations that healthcare providers should have, etc. The final point is also a lot of discussion going on between various agencies about definitions. The notion of, what a breakthrough drug is, or what a priority review is. Well, that might mean currently one thing to Health Canada. It might mean something different to PCODER. It might mean something completely different to a drug plan. Surely there's some interest in a public policy basis to having everyone around a table having a common understanding of what those pieces are and eliminating any inefficiencies or duplications in the system. So look for more of this system-type language, system-type approach, which in many ways is new for us in Canada. We keep building or adding or creating steps in the process, but very rarely have we sat down and really tried to pull it all together. I have to spend a minute or so on drug price regulation. This is something which may be on many of your radars. As you know, last year, the PMPRB, which is a quasi-judicial agency based here in Ottawa, they are the ones who are charged with regulating and compliance on non-excessive drug pricing for patented or branded medications. They did start a process to really look at their overall strategic approach and as well to update their guidelines. So really their rule book, how they implement their policies, are there opportunities to do things a little bit differently? I think in the intervening months we've seen that discussion continue to be an active one, but also now at the political level I think there's a renewed interest in this topic, to the point that you may have seen in January quite a high-profile appearance by the Minister of Health on a CBC documentary program, where she basically said, we are going to take additional actions as a government to quote-unquote save Canadians billions of dollars. We're going to be introducing regulatory changes. So this is now another layer of change on drug pricing. And frankly, we're expecting those regulations to be coming in the very near future, and there may be a reference in the budget to that. Important to note that there will be consultation opportunities built into that process, though. So there will be a discussion paper we're expecting towards the end of March, laying out a lot of these thematic issues prior to a more formal regulatory consultation later in 2017. So starting to prepare ourselves and realize we are going to have the opportunity to be heard, to put some views forward and make sure that our perspectives are accounted for. And in that, I would really stress important to note not just what we see as the immediate impacts of these policies, but perhaps some things that the government hasn't itself quite assessed yet. Those unintended consequences. Are there knock-on effects in other areas of healthcare that we want to ensure are heard and well understood by the government, so that these changes, which could be significant, are done with all available information and with every care, and frankly with the patient perspective at the center of it. I would like to say a word about the innovation agenda. So with all this work in Health Canada and health transfers all bubbling away and sucking up a lot of oxygen in Ottawa, there's in some ways an equally important conversation more on the economic development side taking place, led by the Finance Ministry and also our ISED Industry, Science and Economic Development Minister, Navdeep Bains. They've been working for many months trying to understand innovation policy, what's working well in other countries, where Canada can learn some lessons, because frankly the financial picture in Canada continues to be challenging. We need to generate additional economic growth. We want to see jobs and the benefits of the new economy really taking root here. That's where our future lies. And so in all the work, and there's been a couple of reports released which we can refer you to perhaps through CCSN after this webinar. But what's interesting and I think of interest to many of us is that healthcare and life sciences has really been identified as a potential area of interest. It's one of a smaller number that when all the experts look at this, they say, geez, Canada has this fantastic science. It has this really well-developing ecosystem, small companies, large companies, individual academic researchers, venture capitalists, incubators and translational services, excellent knowledge base to capitalize on and really develop some growth and some wealth. And so we're really looking forward in this budget to see how that is framed. We're very hopeful that there will be a specific reference to innovation, and that will be something we think we can build upon. Government coordination of supports and policies is key. Again, that issue of unintended consequences, but just as much, and the immediate issue that I think is the rub, understanding investment, understanding its impact on something like clinical trials, which are of huge interest, I know, to many organizations, making sure that Canada remains in the top tier of global jurisdictions for that, making sure that we can continue to offer, a standard of care that allows for great competitiveness in clinical research, because that has so many benefits to our healthcare system and so many benefits to our economy. We don't want to concede any ground on that area. So really look out for, on the financial economic development side, how innovation is treated in this budget. So this takes me to the kind of the back part and a couple of thoughts for everyone based on some of these ideas I've laid out, starting to think about, okay, how should we start to approach this budget and what are some ways that we can be involved, knowing that there will be some items here that impact us and that we want to ensure our perspective is heard. So the first point is obviously the most basic one, which is for everyone to get informed. That would be my best advice. The budget date will be confirmed on almost any day. Knowing where that is, when the documents are available, having a chance to go through those. The fine print really does matter. Talking about it within your organizations, making sure that one person's understanding of it fits with others, maybe seeking some additional advice. Really understand, okay, this is what the government is doing. Here's what we think it means for us. And then that allows us to have a discussion on priorities and impacts and then what we want to do about it. Second thought is to start thinking it's never too early about our approach and how we're positioned. What types of activities have we been engaged in, perhaps traditionally? Are we willing to perhaps be perceived in a different way? And of course, there's a whole spectrum here of organizations engaging with government. Some are partners, really quite active and involved, and you can imagine the work it takes to build those kinds of relationships. Some groups tend to be more opportunistic. Some groups are out and out adversarial and quite negative at times on that, very focused on specific pieces. Some groups almost have to be dragged to the table to begin with, are almost reluctant to get involved. Is that something that maybe we've done in the past, and maybe this is an excuse now to reconsider that approach? And then finally, and the one that is always a concern, although we still see it, is those that just sort of avoid the discussion entirely. And that can be, of course, a dangerous approach, especially when some of these important issues are potentially major impacts on issues that are of importance to us. So what can we start doing now? The budget will be out in a few weeks. Let's start thinking about a plan. And plans don't have to be complicated. I've sketched out a few thoughts here that we can start thinking within our own organizations. The basics are who should we be engaging with? Who are the people that set the policy? Who are the people who are most influential on them? This includes political people. Obviously, they're the ones that we elect to set the policy on these issues. But don't underestimate the bureaucratic side as well. And then finally, and CCSN is a wonderful umbrella for this, are there other like-minded stakeholders who are concerned about the same issues that I am or my organization is? I should be reaching out to them. I should be finding that common ground because, frankly, we're going to be much more effective and will be heard all the better when we can do that in a united front. The second is start thinking about the what. So map our concerns against where the government is going. Look for those common areas. That's common sense. I think anybody trying to advance an agenda would look at that. We really want to take a best information or a best evidence approach. Emotional appeals are important and they have a place, but at the end of the day, it's got to be that factual and evidence-based analysis that really is brought to bear. And then starting to think about our tactics. So what types of tools are in my toolbox that I want to use? Do I want to start thinking about written submissions? As I mentioned, there's going to be at least a couple of consultation opportunities. Who's going to be writing that? How do I start organizing my thinking, etc.? Do I want to maybe meet some of my local government officials in my community? Would I be interested in coming to Ottawa? Those are all things which are very much available to everyone, and it's just a matter of organizing and making sure that we've got our arguments lined up, narrowing down and prioritizing those points of outreach, and then actually executing it and getting it done. And finally, the when. So we talked about the budget date itself. That's important, but I do think that post-budget there will be a window, and we'll see those additional pieces. So be strategic about it. Try to coordinate across those, again, like-minded stakeholders. And if you also have opportunities, don't pass those up. So you may be at local events or other functions. If you have a chance to connect and maybe start a relationship or start a conversation, please try and take advantage of that. And the final point here is really that repetition is key. Usually delivering these messages only once is not sufficient. Most of our friends in government are being faced with multiple topics by multiple groups every single day. There's a lot of demands on their brains, and so like any of us, the chance that they can have to be reminded and to have these key messages repeated is important. And on that note, I do think there has been some discussion with CCSN, and I just flag for everybody, perhaps after the budget itself is actually released, we can revisit some of this conversation, knowing the actual content of the budget, having a clearer sense of the government's sort of public commitments and where they'd like to go, and then start to build a plan off of that. So I'm going to stop there. I wanted to allow for plenty of time for questions from the group. Very much appreciate the opportunity. And as I say, I'll be happy to take a few questions, and maybe I'll just turn it back to Chad there. Thank you.